Hi, everyone. My name is Taylor Schwein. I am a senior BSN student at The Ohio State University, and I'm just going to talk to you guys a little bit about stress today and monitoring for symptoms of anxiety, depression, and just kind of how to deal with that right now, especially when there's so much going on in the world with COVID. So first, just some things to be aware of that I'll be referring to throughout the presentation, just kind of talking about what stress actually is. It's just a normal part of life and it's the body's response to change. So it's very normal to have. There is good stress, which is the type of stress that motivates you to do better and work hard. And then there is bad stress, which is kind of when it's really constant in your life and it doesn't go away and it interferes with like your ability to do things every day. And then depression is when you have continued feelings of sadness, low self-esteem, a lack of motivation. And it's okay to feel sad and unmotivated sometimes, but it leans more towards depression when that's something that you feel like you have to deal with a lot and it kind of keeps you from doing what you need to do every single day. And then with anxiety, it's just any type of feelings of worry, nervousness, or uneasiness that you might feel. And again, there's like a good type of nervous when you're just like getting ready to take an exam and you're kind of anxious to see what score you got and how you did. And then there's also bad anxiety, which is when it affects how you're dealing with your life every single day. And keeps you from being able to accomplish things. So that's kind of the biggest way to determine if your feelings of stress, depression, anxiety are normal, or if they're kind of severe and you should consider maybe talking to someone about it, is when it's keeping you from doing what you need to get done every day. And then lastly, the skills that we're going to talk about today are all part of cognitive behavioral therapy. And I might refer to that as CBT during this presentation. And that's just a type of therapy that's focused on changing your thought patterns to make them more positive. So first, I think it's just really important to address that COVID-19 is triggering stress, anxiety, and depression in a lot of people. If you've been feeling really stressed since all of this started in March, you're not alone. A lot of people feel that way. And then on the slides are just kind of some big things that COVID has made us worry about, like being afraid to get COVID. If you're worried, if you have like older loved ones or loved ones who are immune compromised, stress because maybe someone in your family lost their job, all of those things are just really something that COVID is causing from a mental health side too, but you're not alone if you do feel that way right now. And there's just so much stress and anxiety happening within COVID. It's like a mental health pandemic in the middle of the virus pandemic. And this picture just kind of shows one of those other side effects of COVID. I know that at the beginning of the pandemic, sometimes you would go to the store and you couldn't find anything that the shelves are normally stocked full with. And that can be a really scary feeling too. And it's really normal to kind of experience that right now. So going kind of back to stress, anxiety, and depression, as I had mentioned before, experiencing that too much can interfere with your daily functioning and your ability to do what you need to do every day, like schoolwork, hanging out with family and friends. If you're involved in any sports, you don't want it to interfere with your ability to do that. So that's the point where you need to maybe consider getting some help, and you shouldn't be afraid to ask for it. A lot of us are feeling this way, especially right now with everything going on, and there's no reason to be afraid or scared or ashamed to talk about this to someone. So just finding someone, an adult that you really trust, that you feel comfortable talking to this about, whether it's one of your parents, a different family member, one of your teachers or coaches, or whoever you see as a nurse practitioner or doctor. So coping with COVID, this is something that the Dean of the College of Nursing, Bern Melnick, came up with that just kind of goes over some of the biggest issues that we're seeing with mental health and COVID and how to deal with them. So focusing on the things that you can control, because right now there's a whole lot of stuff that we cannot. Opening up and sharing your feelings, trying to reduce stress every single day, being mindful and just focusing on what's happening in the present moment, because worrying isn't going to change anything. Counting your blessings and just feeling that gratitude when you can find something to be thankful for. Turning negative thoughts into positive, which we're going to talk about. Volunteering to help others, because I know when I'm supporting others, it makes me feel a lot better. Identifying helpful supports and resources that you feel safe using and that you have access to. And of course, doing your part to prevent the spread of the virus. So wearing your mask, washing your hands, and taking care of yourself so you stay healthy too. So one of the biggest things of CBT is this thinking, feeling, and behaving triangle that we have on the screen here. So this is just showing you a visual connection of how you think affects how you feel. And as a result, that affects how you behave or how you act. So a really simple example, is you can look at a test grade you got in two different ways. So you get a C on your test, and maybe your first thought is like, oh my goodness, I did horrible. Like, I can't believe that. I really thought I did a lot better. So because you're thinking negatively about the test grade you just got, you start to feel kind of sad or upset or disappointed in yourself because maybe you feel like you could have done better or that you did do better. And when you're feeling that way and you're having those low thoughts, that low feelings, that could cause you to behave differently too. Maybe you kind of feel impatient, or like you get easily irritated, or maybe you're just being kind of snappy with the people in your life. And all of those things just stem back from the simple reaction you had to the test score. So as you can see, all you did was get the test score, and that made you feel really bad. And then it may have caused you to behave really bad as well. But there's another way that you can look at it too, which is what CBT teaches you, and it's how to make a positive thought and a positive reaction to everything. So instead of seeing that C that you got on your test, you can think, I thought that I did better. I'm going to look at what I did wrong, figure out how I can do better next time, make a plan to increase my test score. And then you're going to feel a little bit better. You're going to feel really proud of yourself for taking those steps to do better. Maybe you just feel confident that you have a plan to get an A for the next time, and you just feel prepared to make that positive change. And as a result, your behavior is going to reflect that. So you won't be as upset about the score. You'll be really motivated to study because you're trying to achieve that goal of getting an A or a B or whatever you're aiming for. And that just kind of shows you that you can turn it into a positive situation too. It's the exact same scenario, and it's just how you react to it and how you respond. And it's just really important to remember that these three things are connected, and focusing on one of them and just changing the thinking piece can really help you with the other two. So there's some active components of CBT, which means these are the things that you kind of have to be aware of and like actively try to make better. So reducing negative thoughts, because you don't want to spend all of your time thinking about all the bad things going on. Increasing pleasurable activities, because of course we want to do things that make us feel good and that we enjoy. And improving your assertiveness and problem solving skills. And these are all things that we're going to talk about in the next couple slides. So first, I just want to share some common cognitive distortions, which is a fancy way of just saying some bad things that a lot of us have made a habit in our life. So automatic thoughts are one of those things that at a certain point, you may have been taught this or you may have seen this in others, and it kind of changed how you think. So for example, all or nothing thinking is when you either get an A or nothing else counts. So if you get a B, even though that's still really good, you don't care it wasn't an A. So you either do the best that there is and anything less is not acceptable. And that's a really dangerous way to think, because there are other ways and other grades that are good, and there's other ways to be successful than test scores and your GPA. So it can be really harmful to yourself if you're just so focused on one thing and one thing only and nothing else is good enough. Mind reading is another really common one. And it's when you just think that you know what someone else is thinking without having asked them or tried to talk to them. So for example, she doesn't think that I'm smart. And you really don't have a reason to think that. Maybe it's that they looked at you funny, or you just think that they got a better test grade than you and they know that. And you have no idea if she thinks that or not, but you just kind of really get down on yourself and you're just like, I think that person thinks I'm stupid. And you get really worked up over that. And we're not mind readers. We do not have that ability. So it's really important that we don't get super caught up on that. And if you do think that there's something going on, that you just talk to people. And then lastly, the mental filter is when there's good things happening, but you only see the negative. I think that's really common right now, because when good things happen, you turn on the news and all you see is like the COVID, and all you can think about is that your school is shut down and you can't play the sport you wanted to play, and everything that you're missing, even though there's probably some good things going on in your life too. So like a school related example is that you got a 9 out of 10 on the quiz, but all you can think about is the one question you got wrong, even though 9 of them you got right. So to kind of combat these things and figure out how to stop doing that, in CBT, we learn the ABCs. So the A stands for activator, and that's your stressor. So in the example we used earlier, the test score would be what your stressor is. And then the B stands for belief, and that's the negative thought to stop. So the thought that C means you're not smart enough or you're not good enough would be your belief. And that is the negative thought that you need to stop. So you just kind of have to realize you're thinking that, press pause and change it to a positive thought. And that a C really isn't that bad. And you know that you can do better, and you're going to find a way to do better and prepare yourself for that. And then the C stands for consequence. So that's the positive emotion and behavior that you're happening that is happening because of the negative thought that you got rid of. So since you changed being mad about the C to an opportunity to do better and learn from it, and figure out new study habits, you have a positive emotion and behavior, which is excitement, like a willingness to learn and excited to see how you do the next time. So a good way to work on those automatic negative thoughts is to make sure that you are aware of them when they're happening. So next time that you feel anxious or sad or lonely or mad, think about what's going on that made you feel that way. What's your activator? And it's probably something you couldn't change, which is why it's really important not to think about things we can't change. Focus on what you can. So then you have your trigger or your activator event. And what is your belief? How did you feel after that happened? What were your thoughts? What were your emotional consequences? Did there anything that happened with the way you behaved? Did you start acting differently? And kind of process through an example you had of that and think, what could you do next time to turn that into a positive frame of mind? And that will make you feel better. So it's just important to learn how to recognize when you feel this way, press pause, and kind of work through these steps to make it a better situation. And then just like I was mentioning, you have to catch those automatic negative thoughts in order to change them to positive. So these are just some good questions to ask too when you're upset. What was I just thinking about? Is that really true? Am I just kind of imagining that or assuming that, or is it actually correct? Is this thinking helpful? If it's making you feel bad or if it's making you behave badly, it's probably not helpful. And then do you have evidence to back this up? Just like the mind reading thing. Do you have any evidence that the person is thinking the way that you assume they're thinking? So some thought stopping skills are kind of like visualizing a stop sign in your head the second you start to think negatively, to just tell yourself to cut it out. Or then also using some imagery skills to switch to a pleasant image. So if you're getting really down about something and you can't stop thinking about your test grade or that you missed the goal in your last soccer game, whatever it is, literally make yourself stop and think of something that makes you really happy. Like maybe like you love your pet, maybe the beach is your favorite place in the world. So you start thinking of the ocean and just kind of switch gears to think about something that makes you really happy. So again, we're just programming our brain with positive thoughts, because when you put positive thoughts into your mind and you speak kindly to yourself, positive thoughts will come out and you'll treat others well and you'll behave well. Another great tip for this is practicing positive self-talk. So coming up with statements that make you feel really good about yourself, like the ones on the screen. And then even though it feels kind of silly, saying them to yourself 10 times every morning when you wake up and 10 times every night before you go to bed, because that's literally going to help your brain believe that those things are true. And it's going to make you feel really great about yourself and just put you in a good mood right when you wake up and then right at the end of the day. Another great tip is to take the first few minutes of your day, maybe go over some gratitude things, read a book that you really enjoy, and just kind of take those first few minutes to wake up and set a positive attitude and tone for the day. I know that sometimes we only give ourselves 5 minutes to get ready for class and we're really rushed in the morning and you just kind of feel frantic and stressed out the rest of the day. So kind of giving yourself that time in the morning to wake up slow and prepare yourself for the day. So we mentioned earlier that problem-solving skills are really important to have. And these are just kind of the steps that you need to go through in solving a problem. So of course, first, what is your problem? What's going on? What are the causes of this problem? Is it anything that you did? Is it something that you can control? Is there something you can avoid next time? So figuring out what the root of that problem really is. And then what are the solutions to this problem? And come up with a couple ideas. That way you have some options and you're spending some time thinking about this problem and the best way to fix it. And then once you have a few plan A, plan B, plan C type thing, pick the best one and act on it. And then you'll know that you spent some time thinking about the problem and what's going to make it better. And you can pick whatever one makes most sense to you and you think is going to be most effective. Mindfulness is something we've talked about too. That just means to stay in the present moment. So like right now when we're going over like these slides together and sharing these tips, you're not thinking about the homework you have to do after this or the exam you have next week or the emails you didn't reply to. You were just listening to this, being really here with me in the moment, taking in what's being said. And you'll worry about that stuff when you're dedicating your time to that instead of trying to multitask and think about 20 things at once. Some great stress management apps, Headspace and Calm are some really good ones. These can kind of help you meditate. They can talk to you about like stress and anxiety to work to calm you down. And it's really popular to use right before bedtime to kind of help you calm down and get to a good place before you fall asleep for the night. Going back to the positive thinking, just because this is so important, a great way to kind of figure out what should those positive thinking statements be if you kind of don't know what you should be saying to yourself. Think about 2 thoughts that you have a lot that you really struggle with. If you related to the all or nothing thinking and you feel like you do that a lot and it's always one extreme or the other, how can you change that's positive? Maybe instead of, if I don't get an A, I'm not good enough, it's an A or a B is great and I can always do better the next time. Or I'm smart, I'm capable of getting an A, I know how to study hard. And those are the types of things that you should be saying to yourself 2 times a day, 10 times, 2 times of the day, 10 times both times. And if you feel like you might forget some of these things, it's really great to put a reminder in your cell phone so it goes off in the morning and at bedtime and has that positive self-statement written on there so you remember to say it. Or maybe you want to just do this when you brush your teeth every day. So you put a little post-it note on your mirror and that's going to remind you to say these things. And then the last thing that's really, really important to remember is that this takes a lot of practice to be good at. It's not something that you can do for a couple days and you're never going to have a negative thought again. It takes a lot of practice to learn how to stop yourself when you think those bad things, how to press pause and work through them. And it's something that you do have to practice at, just like anything else to get good at. So don't get frustrated with yourself if you've been doing it for a week or 2 and you just feel like it's not sticking. It takes about 30 to 60 days of doing this constantly to really master it and just have it be a part of your everyday life. And then lastly, this is just putting the ABCs into practice, a few examples of working through some of those problem solving skills we talked about, as well as the ABCs. So you can look at this slide to kind of think of a situation that was not fun for you, that really upset you in the last week or so, and prepare yourself for how you can handle it better next time and how you can have a better reaction by working through those steps on the slide. So lastly, remember, just stay positive, maintain hope. Nothing lasts forever. It's going to be okay. Things will get better. Thank you so much for joining us today. This was from the Office of the Chief Wellness Officer, Dean Melnick, and Buckeye Wellness.